Good morning, everybody. I'd like to welcome you to CFM's virtual event, the Pandemic Preparedness and the State of the Vaccine Rollout. This is our fourth virtual event, and we are glad you could make it out this morning. We have a great panel for you, and before I introduce them and our moderator, I want to thank some of our sponsors. The Blair Family Foundation, Riveting Women, Adventist Healthcare, Itinerary Infrastructure and Concessions, Lurch Early Brewer, Montgomery College, Montgomery County Chamber of Commerce, and the University of Shady Groves. These are our diamond, platinum, and gold sponsors, and we thank them again for their sponsorship. Our speakers this morning, we have a great panel. Brendan Johnson, VP of Human Resources at Adventist Healthcare, Yancey Phillips, Chief Clinical Officer at Holy Cross Health, and Ariana Kelly, our state delegate from District 16. And I'll pass it off to Lou Peck, who is our moderator this morning and will guide us through the event. Lou, on to you. Thank you.
Thank you and good morning to everybody. Good to have everyone here. Brendan, Yancey, my neighbor, Ariana Kelly. Before we start, I just a couple of a brief introductory note, and that is that I don't think anybody disputes that there have been challenges and obstacles associated with this vaccine rollout, and I'm confident that there will be numerous examinations once the pandemic is over at both the state and federal level in terms of what happened, what could have potentially been done better. Obviously, a large factor here has been the fact that supply is, I should say, demand is far outpaced supply in the early going. Having said that, our focus today here is not really a hindsight look at how things might have been done differently from the get-go, but rather to discuss available options for getting as many people as possible vaccinated going forward, and doing so in an expeditious manner that minimizes some of the frustrations that many people have experienced in recent weeks. And with that, I'd like to first focus on Yancey and Brendan and their enterprises and what they're doing, and a little bit later bring in Ariana, who has been very involved in oversight at the state level. So Yancey and Brendan, could I give you a few minutes just to talk about sort of the scope and structure of the programs that you're operating as far as vaccinating people? And if specifically, if I could ask at the get-go, the groups that are eligible for your vaccine programs, and particularly I'm focusing on that because I know the county health department, which unfortunately is not represented here today, has been focusing before getting to the so-called 1C group of 65 and over, has been focusing on getting the 75 and over group done. And one of my questions, which I asked you to cover, is I am assuming that the 65 and older group are eligible for the programs that Adventist and Holy Cross are operating. And if you could talk a little bit more also about some of the other groups who are eligible to sign up for your programs at this point.
Thank you. It's okay, Brendan, I'll start. I'm Yancey Phillips, Chief Clinical Officer for Holy Cross Health, and I oversee the vaccine program for us. But we were, in preparation for this, we were talking last night, and I think it was worth taking 1 or 2 minutes just to talk about the incredible changes both of our organizations have gone through throughout this. We actually are celebrating here the 1-year anniversary of standing up our Incident Management Center and reflecting back on all that has occurred in terms of the number of patients, the changes in our practices and policies, the way volumes have shifted back and forth. I mean, we could spend the hour talking about that, and I promise we won't. But it also was, I think, a time of significant collaboration between the hospitals in Montgomery County, really leveraging the work that had been done previously in Nexus Montgomery Regional Partnership. And I know that we would speak during the height of the pandemic on a weekly basis, the chief medical officers of the hospitals in the county, and we really have looked to actually particularly look to Adventist as a partner in this. The work that they've done with their alternative care center has greatly unloaded our practice. They've been tremendous partners through that. And so maybe Brendan would want to reflect on that before we go on to the vaccination programs.
And I appreciate that, Yancey. And as you mentioned, Lou, looking forward, I think is important, but building that foundation of what we've wanted to do throughout the pandemic to really support our community and work with our partners. 2020 was a unique year. And as you mentioned, I think we'll have an opportunity to look back, not just at the state and federal side, but across the country to say, there's a lot of things that we'll look at and say, man, we were really smart to do that. And other things we'll say, what were we thinking? But I think that what's been great out of this is the partnerships that have just solidified. Adventist Healthcare has worked with the state to set up an alternate care site at Tacoma Park that's eligible for anyone within the state to take care of the COVID patients, to transfer those there, to maintain operations with our colleagues at Holy Cross and other hospitals. And I think what's been great about being able to shift into the vaccination process is continuing to work with Nexus Montgomery, as Yancey had mentioned, with our county officials and with our state officials. To talk a bit about where we had started with that, I think it's important. We've step by step tried to work within the state guidelines and CDC guidelines. And to remember at the beginning of this was a vaccine that many people had questions around, any side effects you would have. We were encouraged to go slowly. That first group, the 1A group for healthcare, was a very narrow group that we started with. And what's been exciting to see across not just the hospitals in the state is the ramping up of both the production and the number of vaccines that are coming. I think that part of what's been frustrating is the challenges of how to find that, how to sign up, where to go. And I'm sure we'll have an opportunity in talking with our team today. But we started out, in conference rooms at the hospitals, and we've gone from conference rooms to setting up community clinics across Rockville, Tacoma Park, Silver Spring, Fort Washington. So I think there's been a lot of good that has come out of this with the partnerships that we've solidified across our hospitals and healthcare systems in our state and county, understanding that there's a lot that we can still do to continue to support our community, not just when they're sick, but trying to keep people well as well.
Well, as I said, if I could ask you to talk a bit about who's eligible, how do you sign up? I think that a lot of people listening today who are eager to get vaccinated would like to get some of those details.
When we began our vaccination, as Brendan said, the initial focus was on healthcare providers and our own healthcare providers, and we provided clinics inside the hospital here in Silver Spring and in an alternative care site, actually an area we'd stood up to potentially care for or triage COVID patients up at Germantown. That turned out to be something I think that was harder for the public to access. So over the last weeks, we've actually transitioned to a larger space, just one space right now for Holy Cross Health, in addition to some of our community outreach, but a space that allows us 15 vaccinators at a time. And as we ramp up with availability, we did make the decision early on to mirror, I think, the emphasis that the county had on over 75s. We knew that we had a large population ourselves associated with our health centers and community practices over age 75. So we have used our website as the mechanism to connect to appointments. I think that's led to some frustration, because what we have done is we have opened up appointments at specific times. We have used a sort of an attestation process through the website to identify individuals in priority groups. And we have continued to emphasize the 1A, which are healthcare, public safety, basically, and 1B, which are over 75 and certain occupations, public safety, principally educators, childcare, etc. So we have sort of had the folks in those broad categories over 75, and then the occupation related A and B categories, and provided separate links and clinics to those so that we could actually protect some of those going forward. That has, I understand, led to frustration because it is when they are put, if you will, on the market, there's a race for those. We do announce when they will be released. And so to some degree, it is a first come, first serve at that time. And one of the reasons that we have set aside appointments for over 75s is we have found that the school teachers are much more nimble and agile with their keyboards than folks over 75. So had we not done that, we would have had all teachers and nobody else in that priority group. We have also worked with the county recently to take, as many of you all know, the county has done a pre-registration process. We have encouraged everyone who comes to our website that they should pre-register with the county. That doesn't preclude their ability to pursue appointments with us or with Adventist or Six Flags. But I think ideally, we would all have some sort of a vetted registry that we worked off of, one single list for truth that we could logically work our way through. We don't have that right now, but we did take 1,000 names from the county over age 75 and issued invitations to those individuals. Again, it's our first venture into that, but that's something that the county has been doing for some time. I do want to acknowledge their success in getting vaccines out. We have given about 15,000 vaccines. That's a combination of first and second doses. I think Adventist has given some 23,000 out, a very significant number. These are things that are reported every day of the week. And Montgomery County has actually provided some 56,000 vaccinations overall. So again, our approach has been to focus on 1As and Bs and including setting aside appointments for over 75s at this time. We clearly expect to go to the 1C population and other occupations, but to the extent we can, we'd like to make it less of a gold rush and a little bit more of an orderly process.
When do you think you'll be getting to the 1Cs?
If I could, the one piece, because we may be a little bit different than Jens, we've taken a very similar approach, but we have been following more of the state guidelines as well as those phases are open. So the 1A and 1B are on the occupations and the ages with the healthcare and the education sector, but we have actually started seeing 65 plus, which is that first area of the 1C that the state had opened up as well. So at Adventist Healthcare, we've taken a very similar approach, posting open slots and registrations on our website. Now we've got an alert me function where people can sign up to be alerted that they'll get an email distribution right before our slots are opening. But we've done it a little bit different. We haven't set aside specific hours for different groups, and we have gone down to the 1C 65 plus eligibility. That being said, out of the 26,000 shots that we've given at the community clinics, we have seen over 54% of those being 65 and plus. So we've got some nimble 65 plus keyboardists as well. That's the one difference I think on our side of it. We've tried to lean a bit into the state phasing with that.
So one of you is doing over 65 and one hopes to get to those soon at this point. Let me ask this in terms of whether you're in the 1A, 1B group or whether you're in the 1A, 1B, 1C group. Is it strictly an online sign up at this point, or are there options for phones? Obviously, a big concern here has been, particularly in the older age category, people who are just not particularly computer literate or are not online, having difficulty in terms of signing up. So I'm just wondering what kinds of options there might be for those folks who are not comfortable going online.
We don't currently have a call center that has been stood up. We've seen again over 55% of the people that have come through our community clinics have been 65 plus. So it's where we continue to look not just at the age but the demographics as well on a regular basis to see if there's any inadequacies or access issues. I don't know if a lot of the issues at this point are more access issues or just volume issues. It's something that a lot of people are interested in, and as Yancey has talked about, we don't know our supply coming in until late the week before. And so we can't open up slots necessarily until we understand what's coming in. So while there seems to be some type of a race to sign up, we're excited about what the state is doing on with the mass vaccination sites. I think that across the county and the state, everyone is trying to do their best to get as many people registered and as many shots in as possible. But at this point, we continue to try and be as clear as we can with those interested in signing up about how to get to the website. We've got calls that we'll sometimes put out for questions, but we don't currently have a call center set up for inbound calls.
And if I may, Lou,
sorry, go ahead.
Just
Go ahead, Ariana.
to follow up on Brendan's point, the state mass vaccination sites do have a call center. The county has also opened up a call center. The county's call center is to get on that pre-registration list that Yancey was mentioning, but the state's call center is for folks who are trying to make appointments at the Six Flags site or the Baltimore Convention Center site. And in the coming week, there's going to be a lot of appointments opening up at the new Ravens Stadium site. So the call center will work for all of those appointments. And in the last week, there were about 19,600 vaccines given out at those mass vac sites. So it's a lot of vaccine in the scope of things.
I will say that we do have a small group within our community relations team that does do outbound calls. If we've identified someone who's often told us that they've not been competitive in trying to get to appointments, or we hear a referral from a neighbor that someone who does not have computer skills, we will do outreach, but it is relatively small, and we do try to get them into clinics. As was alluded, vaccine supply and knowledge about vaccine supply is very time sensitive. We do not know right now what vaccine supplies we will have next week. We have openings in our clinics and no vaccine. So we've not opened some of those appointments up. We probably, like Adventists, are in the midst of doing a fairly extensive second dose clinics. That's one of the things that we are very focused on, is making sure we get people in for a second dose in a timely manner, and mostly that they get in. You know, the guidelines, the 21 days after Pfizer, 28 days after Moderna. Well, my analogy is it's like horseshoes. You have to get kind of close to 21 days. It doesn't have to be exact. It doesn't have to be a ringer. So we do have try to offer people options of when to schedule. If someone has had a vaccination with us, we send them an invitation with a link to schedule on 1 to 2 or 3 days, depending upon the schedule as it goes forward. But again, we are very dependent on the state for allocation of vaccines. I think the hospitals have played a tremendous role in getting this going, and I think we are key representatives of the community, and we provide services for our community, whether it's at a vaccination site like Holy Cross or at Fort Washington, or if it's in a community clinic, as we reach out to individuals in independent living. I know that Adventist helped folks at Riderwood. We went to Asbury Methodist Village. MedStar Montgomery is addressing vaccine concerns at Leisure World, some of the big CCRCs, but we're also looking to go to some of the Housing Opportunity Commission housing, the subsidized housing, where people have perhaps less opportunity and access at one of our other sites. So outreach is a key part of the hospitals, but we've invested significantly in the capacity to vaccinate the community in our sites, a variety of community sites here, again, adjacent to Holy Cross Hospital in Silver Spring. We were very fortunate. We had great cooperation from the county. County assisted us in getting material and internet access in here. So we are ready, willing, and able. We just don't have enough vaccine to move forward.
I wanted to get to the allocation issues in a few minutes, but if I could just wrap up on this segment by Brendan, you mentioned sort of a land rush, if you will, of people trying to sign on without trying to intensify the land rush. Are there particular days of the week where you usually hear about what your supply for the coming week is, and where, somebody's chance of getting an appointment is heightened if they call at that time? And my second, sort of somewhat unrelated question, but has to do with outreach, is the whole question of to what degree Adventist and Holy Cross are trying to target minority communities, because I know that there has been concern about minorities being vaccinated in a proportion that's lower than their overall proportion of the population.
Thanks, Lou. First of all, on when we find out, it typically it's a fluid situation. We don't necessarily hear until the end of the week what our allocation will be for next week. As Yancy had said, we don't know what we're getting next week. And I know we'll talk about allocation in a second, but some weeks they'll say you're getting 5,000, some weeks you're getting 500. And so part of what we want to do is, I wouldn't say there's specific days that we can have that knowledge until we get more of a set process down. And understanding it's not just the state. This starts at the federal level where they allocate it, then it goes through the state and the county. I know that we've actually heard that the weather and the shipping is being delayed right now because of the weather. So part of it is, and I'm sure the Holy Cross is doing the same thing. We don't open slots until we know we have vaccines, because the last thing that we want to do is have somebody sign up, get that confirmation just to be canceled later. So when we receive the number of slots the coming week, or vaccine doses for the coming week, we sit down with our team, we plan out the clinics, Tacoma Park, Rockville, and Fort Washington, and then we'll send out an email to that distribution list to say we're opening registrations. This is the number of doses that we have allocated. Sign up at this point. And as Yancy had mentioned as well, on the second doses, we really want to make sure people sign up for that second dose. So when we sign up people for the first dose, when they come to the clinic to receive that vaccine, we actually register and sign them up for the second dose while they're in the clinic with us, so that they know when they're coming back, when they can expect that. And again, it's important for us, if somebody gets signed up, if somebody has a confirmation, they need to know that we've got a dose waiting for them, literally with their name on it.
If I can just,
Ariana, go ahead.
So I've just been dying to get into this because I know that hospitals are really struggling with the lack of predictability and allocation. Just want to make sure that everyone's clear that, so about 40% of the doses are going into the health department for the county, and 50% are going into the hospitals. So last week, we provided some consistencies for the health department doses. So they have 4 weeks advanced planning ability right now at the health department level. At the hospital level, we don't have that yet, but we are working towards that. One of the ways that hospitals have been able to get some predictability is by entering into sort of special deals with the state. So for example, when Hopkins agreed to vaccinate our educators and our over 75 plus, they got a giant dose, allocation. It was meant to cover more than 1 week. Same thing with MedStar. They agreed to do Leisure World. They got a giant allocation that was meant to cover more than 1 week. So because the hospitals are participating in this way in sort of these ad hoc special projects, it really makes the allocations a little bit more complicated. The state has a really sincere interest in getting that over 75 population vaccinated for the singular reason that that's going to reduce the burden on our hospitals. So we know that's in the interest of the hospitals as well. So I think the more hospitals can do the kinds of partnerships that we've been talking about, with making sure that those independent living communities and the communities that are highly densely populated senior areas are getting vaccinated, the more predictable allocation they're going to be able to get from the state. That's our priority for the next 3 weeks. And then after that, it's going to be a priority to get that 65 to 75-year-old population as well.
Go ahead.
I think that that's a really important point. Part of what's interesting last week, and I think coming forward, is it's gone from the 40% and 50% down to about 10 to 15% at this point. I know all the hospitals across the state were allocated about 10,000 out of the 88 this last week. And again, we're excited about the mass vaccination site. We're excited about supporting the state and county. I think that as Yancy has said, at this point, many of the hospitals and health systems have set up community clinics and capacity. And we've seen our allocation go from 5,000 2 weeks ago to 500 this week. And so it's not so much the desire to work with that. It's more just trying to find the way to be good partners within the community to vaccinate those that we can, some of those harder to reach areas. But it's actually about 15% versus the 50. just as we're starting to shift more towards the mass vaccination side?
Well, the numbers I was using were the numbers that are particularly allocated for Montgomery County. So what's happened is the state has created other tiers where they're siphoning off the top, right? So those doses for the mass vaccination sites are not allocated to Montgomery County. So they're not part of that calculation. We know that a ton of Montgomery County residents are going to the mass vac sites. And we also know we don't have one in Montgomery County, which is another huge problem we can talk about in a minute.
Let me follow up on that. Are there discussions about a mass vac site in Montgomery County along the lines of Six Flags or the Baltimore Convention Center?
There are discussions. They are one-way discussions with the county delegation, the county council, the county executive, all begging for one, and the governor and the administration saying no. There's been a lot of pressure to create one. What is happening is that right now, Montgomery County residents are going into Six Flags quite successfully. It is important to the governor that those mass vaccination sites succeed. He's already set up the one in Prince George's County, the one in Baltimore. A second one in Baltimore is going to be opened next week. And then after that, there's plans
The Bank Stadium one, yeah.
Yes, and there's 3 more being rolled out in early March that are also not in Montgomery County: Western Maryland, Eastern Shore, and Southern Maryland. That's going to give the state a significant number of these FEMA-approved mass vaccination sites, with none of them in Montgomery County. But because there is evidence that Montgomery County residents are absolutely willing to travel to all these sites across the state, they have the capacity to do so, they have the time, they have the money. We're basically victims of our own success, right? That's a huge challenge. That being said, after those next 3 sites are set up, there will be another wave of sites set up for the beginning of phase 2, which will align with Montgomery County's 1C, those groups of folks with pre-existing conditions. This is where you really get at both reducing hospital burden, but also those disparity gaps you were talking about, particularly with the Latino community. We need to make sure that by the time we start phase 2, which is Montgomery County 1C, we have a mass vaccination site in Montgomery County.
Which is the timeline of what?
I would say second week of April, second week of April.
Okay.
Yeah.
So in other words, notwithstanding the reluctance so far of the state to do a mass site in Montgomery County, the pressure remains on the part of the delegation and others to
tremendous amount of pressure. But also, we have to recognize that right now, for the foreseeable future, we're dealing with Six Flags being our primary mass vaccination site. No matter how much we bang our heads and scream, they're not changing that plan. It takes a lot of work to set up these sites, and the singular focus, which I think is good, of making sure that the folks who are most vulnerable are getting vaccinated within the next couple of weeks, is going to help us all with our health outcomes overall as a state.
Question I asked earlier that I wanted to get back to, and Ariana, jump in on this too. You alluded to it just a second ago, and that's the whole issue of some of the minority communities, and the fact that I saw statistics the other day that in Prince George's County, I think, which is obviously a majority Black county, has the lowest vaccination rate of any county in the state. It was about 7% when I saw it. Are there efforts being made in terms of active outreach, and be it on the state's mass sites, be it on the hospital sites and other sites, to try to make sure that these vaccines are accessible to these communities?
So go ahead.
No, Ariana, go ahead.
Oh, well, so from the state, the county and the county council have been working tremendously hard on this, particularly with their 4,500 a week allocation. So in that pre-registration list that we talk about, they have prioritized targeted zip codes. Those zip codes are identified based on COVID death rate and the rate of COVID spread. We know that COVID cases are spreading in Montgomery County at a much higher rate in those diverse zip codes. So people in my district, have been pretty frustrated because their name has not been coming up on the county health department's pre-registration list. And the reason for that is because we are going first to the places that are most at risk for the folks who are have the hardest time going to one of these other private clinics to get a vaccine. So that is the focus, like a laser, of the Montgomery County Health Department right now. In terms of the state, the Prince George's County site, they set aside a number of doses for Prince George's. They called through their pre-registration list. They really struggled to get people to come to those appointments. In Baltimore, I know they partnered with Hopkins to try and get these targeted communities vaccinated. I can tell you because we had a conversation with Dr. Page from Hopkins about how they did outreach, particularly to the Latino community in Baltimore. And it was a real struggle, a lot of work. They had, I think, 100 appointments to fill, and it took a week of constant communication to get those 100 appointments filled. So it is hard work. It is incredibly important work. It cannot be neglected, but it is not easy right now. So we have to be able to put in the sweat.
Actually, we are doing some outreach to Black churches in the community and into the Latino community. But we have health centers. We have 4 health centers in the county that serve primarily an uninsured Spanish-speaking population. And I would echo what Ariana said, that we have set aside clinic time at our vaccination sites with interpreters, with specific invitations, and have been challenged to fill 100 slots for those individuals. I do think we need to do a better job of mass communication. It is really an educational issue across the board in the Black and brown community. We know that there's a lot of distrust in the Black community for understandable reasons over a long period of time. We see that in our own internal populations. The Black individuals are a little bit less likely to be vaccinated. We've vaccinated about 2/3 of our colleagues. And we continue to emphasize the importance for their safety, for the community, for their families, for all of us, that we need herd immunity in the hospital as much as we need it any place else. So it's got to be an ongoing thing. I know the governor has done some communication with trusted voices across the state from those various communities.
On our side, just quickly, because I think that's an important question you ask on the disparities. The 2 primary clinics we've opened at Tacoma Park and at Fort Washington, we've tried to target that in a way. And what's interesting is we monitor our vaccine demographics and data to look for any disparities or any countermeasures we need to manage. So we actually looked to significantly increase our Fort Washington footprint just for the vaccination clinic, moving it from kind of a physician office building into Harmony Hall, the community center that's down there. What's interesting again is we went from having a couple of thousand a week that we were scheduling down there to receiving about 100. So it's one of those things where you want to partner with the state, the mass vaccinations and others, that as you start building these targeted centers, it's one of the challenges is just trying to look ahead at allocations to the best way to fulfill those community needs.
Following up on that, and Ariana, I'll direct this to you because you've been in a lot of these meetings. I believe that Bob Atlas, the head of the State Hospital Association, was quoted about a week ago as saying that something like 40% of the vaccines on a weekly basis were going to hospitals. It sounds like from what Brendan is saying that the supplies are dropping. And I don't know whether that means that more of what had been going to the hospitals is being diverted to some of these mass sites. But could you sort of clarify what the sort of, if you will, allocation division is at this point among the mass sites, the hospitals, the county health departments, and of course, one thing I'm not clear on is some of the pharmacies doing it. I'm not sure if they're getting it from their supply from the state, or they have a deal where they get it directly from the federal government. I think it's helpful to sort of, if you could spell this out.
So the answer is yes and yes. One of the reasons it's so complicated to talk about allocation is because you have different sets of numbers going around. So we have in Maryland been getting a steadily increasing federal allocation since President Biden came into office, increasing about 5% a week. This coming week, we're looking at an increase potentially of 20% because Biden has been doing an effective job of getting more doses for us.
Can you translate that into quantity when you say a 20% increase? How much quantity?
So we started at 72,000. It went up to 80,000. It went up to almost 90,000. This week we are expecting, I think, well over 100,000. But as has been alluded to by some of the hospital representatives, that increase is not being passed on to the health departments or to the hospitals. They're being held even. There's reasons for this, right? The state has a plan that involved opening up these mass vaccination sites, which is creating access for a lot of folks who don't have it. They're the ones with a call center. They're the ones that have appointments pretty readily available. It's still hard to get an appointment. You still have to work at it, but a lot of people are succeeding at getting appointments, which is a good thing. But we have also increased allocations to our pharmacy partnership, which is with Giant, Safeway, Rite Aid, and Walmart. That's a state pharmacy partnership. Those allocations are going from the state to those pharmacies. We are trying to expand the number of pharmacies across the state that have vaccine access. And simultaneously, part of the Biden administration's plan has been to expand the federal pharmacy partnership. So those stakeholders that for the first few months of vaccine allocation, we're working exclusively in nursing homes and assisted living. They have finished the first pass of all of those. In Montgomery County, it was more than 13,000 people, seniors, got their doses through Walgreens or CVS. Now, last week, the feds sent another 20,000 doses to Walgreens and CVS directly. So that's on top of the 90,000 we got last week, right? And that allocation is also increasing, which is great. We're seeing a lot of people getting appointments across the state at CVS in particular. They've been doing a bang up job of getting people in and out and vaccinated. The other thing that does, having the pharmacies have a stash of vaccine, it gives us the opportunity to partner with them as well. You heard me ask the hospitals before, like get to those high density senior population communities that were not part of this assisted living or nursing home program because they are not getting vaccinated at the rate we need them vaccinated. So the pharmacies can partner with them too. So we have Little Falls Village, which is a senior village, is coordinating a partnership today with Giant Pharmacy. They're going on site to a community center where there's hundreds of seniors who've been desperately waiting for a vaccine. It's in the pharmacy's interest because it makes it easy to vaccinate a lot of people at once, and it's certainly in the community's interest. So we want to see more of those partnerships begin to take place through the pharmacies. The federally qualified health centers are also getting doses directly from the federal government. This is a new program starting the beginning of March. The appointments will be available. The vaccines should be on hand a few days before that. And the first FQHC in Maryland that is getting doses is based in Silver Spring, thank goodness. So that's more doses coming into Montgomery County, specifically targeted for our low-income community. Is that helpful?
Yeah, it's question just popped up on the screen that I think is worth asking. Is obviously I think I mentioned sort of the four ways that this is now being distributed. Somebody asked about whether or not there are plans for any kind of mobile vaccination clinics, and I would start with the two gentlemen from Adventist and Holy Cross, and then go to you, because this strikes me as a way of trying to get this out to a lot of underserved communities for people who just are who just can't get to some of these mass sites.
On our side, I know that part of the question was also going into communities that can't necessarily, they're homebound or can't get out. We've looked at it on our home health network. Again, as Yancey mentioned, we've partnered with Riderwood community. They've partnered with Asbury to go into some of those communities. What's interesting on the mobile vaccination units, I think there's going to be a lot of those that are going to be able to pop up. I think Secretary Schrader has said he wants a vaccine on every corner. So part of, I think, what's important about getting there is the criteria around refrigeration for both the Pfizer and the Moderna makes it sometimes difficult on the mobile units. But as you have AstraZeneca, Johnson & Johnson, I anticipate a lot of these becoming much more available throughout many different avenues and many different channels. But I'd love to hear from your side as well. I think the partnerships we're looking at now are more going into community centers, retirement centers, those type of things. When you talk about the mobile side of it, I think those hopefully aren't too far behind.
Yeah, I agree. I think the mobility is our ability and willingness to take pharmacists and vaccinators and others to community sites to be able to do it. We'll be next week in Kingdom Freedom Hall in Prince George's County to do a vaccination clinic with them. They are also a food distribution point for an underserved community. As I know, we are close to the border with Prince George's County, and I know that Adventist with Fort Washington and others plays a very significant role in that.
And let me just add that right now, so as I mentioned, in the next 2 to 3 weeks, we need to get everybody who wants a vaccine who's over 75 vaccinated. As of last Monday, there were still 17,000 people over age 85 on the Montgomery County wait list. So we have a lot of folks who are elderly and vulnerable to death, extremely vulnerable to death, who still need the vaccine. We tried to vaccinate them through the long-term care and assisted living partnership, but the folks who've been left behind are those folks who are still living in their homes or living in apartments that are not technically classified as long-term care. So we need the hospitals to partner by going on site to those places. We need the pharmacies to do the same thing. However, after we get that population vaccinated, we're going to be talking about really getting into those essential worker populations and those targeting those communities of color that are so vulnerable. I know that Prince George's County is leading the way right now. They have a part, which of course, as Lou mentioned, their vaccination rate is extremely low. They've needed to be innovative, but they have a mobile unit that is being tested out this week in Langley Park in partnership with CASA. My hope is that that will go well, and we will have a similar partnership in the Wheaton area in Montgomery County. I just want to drive this point home. You know, obviously seniors have a huge risk of death. That being said, when we talk about disparities, one of the most important things I learned this week was that, you know, in the white population, only 10% of deaths are in people under 65. In the Black population, it is 30% of deaths, and in the Latino population, it is 35% of deaths. So one of the reasons we're seeing these disparities is because these seniors who we absolutely need to vaccinate, you know, they're disproportionately white, and the folks who are dying in the minority communities are disproportionately younger and not yet eligible for the vaccine. So, you know, we're going to need to build that groundwork to do that work. You know, again, in about 7 to 8 weeks, I would expect is when we're opening up to 1C in the county or to phase 2 for the state.
Let me, a couple of process questions. Ariane, I'll start with you. Realizing that this is not a discussion of what could have been done differently from the get-go, but I'm wondering, going forward, are there any discussions underway at the state level about trying to centralize the registration process, as opposed to experience I had in getting a shot, where I think we had to sign up at about 6 different places and finally struck pay dirt with it at CVS pharmacy. But I think, you know, it's been frustrating to a lot of people that have to sign up at so many places and then often not hearing anything from them. So I'd be curious to hear what if there's any discussion along those lines going on at the state level.
So I think, I mean, obviously there has been discussion. Again, it's been somewhat of a one-way discussion. There's been a lot of requests and they've been largely rebuffed. I can tell you the reasons the state is not interested in doing that. There's 2 different ways you can look at a centralized sign up. There's the, you know, sign up for your appointments that's centralized, which is the West Virginia model. They have one hospital system in West Virginia. We have multiple hospital systems. At this point, we have already on-ramped all of these different pharmacies, as well as the FQHCs, and, you know, all these different providers. They all have different rules and basically want to be in charge of their own appointments. So it's hard, much harder. There's the other Virginia model, which is just a centralized pre-registration list, which I think Yancey was talking about. Here's a problem with the Virginia model. I think it's a great idea because it will show us statewide that Montgomery County has a lot more demand, right? And a lot more need and needs more doses. But I don't think that the county health department is going to want to give control to the state in terms of prioritizing the pre-registration list. Fairfax County opted out for a reason, right? I think that because Montgomery County is laser focused on these equity issues, as they should be, as what is basically the vaccinator of last resort for our county residents, you know, they want to be able to make sure to set the order and prioritization based on where the hotspot zip codes are.
Let me ask, and I'll direct this primarily to Yancey and Brendan. I think one question a lot of people have is, okay, they finally get in for their first dose. Should they expect from your enterprises to be told when they are scheduled for a first shot, when their second shot's going to be, or is that something that's going to come later?
I think it can be done more than one way. We did sign up our colleagues for their second shots, but we have found in terms of meeting individual schedules, the efficiency of on-site movement of patients. I think one of the things that we've done is we have got people on-site, vaccinated, observed for 15 minutes and out, and net of about 30 minutes, including an older population. There are not a lot of waits when you have appointments and an efficient operation, and we hope to be able to continue to do that. What we have found effective is once we've done a week's worth of vaccinations over the course of that week, we will set up a second dose clinics 3 weeks out, usually on three days of that week as a sort of a scheduling pattern. And then on the weekend after individuals get their shot, we offer them those 3 days through email direct to those individuals and their chosen email, or rarely telephonically if that's their choice of how to be communicated. But there are other ways of doing it. And I know, Brendan?
Yeah, our approach has really been instead of trying to reach them a second time, during the 15 minutes that they're being observed, we've got team members that sit down with them to say that when works best for you in 3 weeks if it's Pfizer, or 4 weeks if it's Moderna, with the horseshoes, plus or minus a couple of days on both sides, so that when they leave that clinic, they have an expectation and a second appointment for when to come back. We haven't gotten as sophisticated as the dentist offices where you send yourself a postcard, but they at least have a piece of paper that's written on there when you're coming back for your second appointment, where it is. And if they need to change that, there's always a way to reach out. But we found it much more successful. We have them during that 15 minutes to answer questions, get them registered for their second shot versus trying to reach out to them again. But as Yancey said, I don't think there's a perfect way to do it as long as we can get that second appointment set up.
And I think that's the key, is the commitment. If we give you your first dose, we're committed to making the second dose available to you in an appropriate interval.
And I'm noticing in the chat, someone's mentioning that Six Flags requires the second dose appointment be made. What we're talking about really is the difference between what has been the county health department way of doing it and the state recommended way of doing it. So the state recommends that every vaccinator set up the second appointment at the time of the first appointment. The county has found that that is not efficient, and they do it in a different way, which has been working to get second doses out. But the reason you see different providers with different processes is because they're either following sort of the county practice or the state practice.
Yancey and Brendan, we're starting to run out of time, but I wanted to touch base on this one because I'm sure it's a question a lot of people who has set up appointments or had their first dose. Are your enterprises primarily using the Moderna or Pfizer vaccines? And I ask this in part because I've heard through word of mouth that particularly with the second doses, there sometimes can be more pronounced reactions in the aftermath of the second dose with Moderna. If you could speak to this at all, I think a number of people listening today would be interested.
Yeah, we have used almost exclusively Pfizer in our hospital clinic because we can support that cold chain. In fact, we're very surprised when all the Pfizer disappeared last week, and I'm presuming it's in freezers at Six Flags or at CVS. We have used some Moderna more for outreach. We'll use that for dialysis patients, for homebound patients, where we need a little bit more flexibility in getting that out. But we will give whatever the state allocates to us. We're happy to take lots of Moderna if that's what they want to do. It's also a little bit mixing the two in terms of clinics and timing can be complicated, and I think Brendan has got some experience with that.
Yeah, we've received both from the state. We've, as Yancey said, we've from the very beginning said we'll take any doses that you can give us. So out of the 26,000, it's probably pretty close to 50-50, 60-40 with Pfizer and Moderna. We do try and make sure that as we're scheduling a clinic, it's a Pfizer day, or it's a Moderna day, or it's a Pfizer clinic and Moderna clinic, just because it is important. If you have a Pfizer first shot, you have a Pfizer second shot. So we don't want there to be any confusion on that side of it. In regard to your second question, Lou, with the reactions, the CDC and state at the very beginning had said, try and plan accordingly. If you have a lot of people, we didn't know that if there would be bad side effects or not, and we luckily haven't seen very many. But we went through and scheduled 20% of our departments at a time. So that if you had a number of call outs, it wouldn't affect the entire department. It wouldn't make you close or move staff around. So we've not had a lot of call outs. We did have more from the second shot from the first shot, but we've not had to, it hasn't inhibited our ability to care for the community or to have to transfer for too many people around. But I would say that the second dose, at least we've seen more side effects with that, but it hasn't at all inhibited our ability to care for our community or our patients.
Talk a little bit about, just so people are aware of what kind of side effects, might, we're not talking about extreme reactions here, which I know are quite rare, but some of the more normal side effects.
Well, the side effects are like any immunization. The most common ones are local, a little bit of soreness, achiness at the injection site. The second dose of these in some individuals has prompted a significant immune response. I take that as good news, means your immune system is responding and doing its business. Personally, I did not have a second dose reaction. I was a little disappointed. I hope that everything was right in getting that done. And to me, it was like a lot of the things, the shingles. Shingles second dose causes a lot of some muscle aches, pains, occasionally fever and chills, sort of flu. That's why sometimes people think they've gotten the flu from the flu vaccine. It's and you're not going to get COVID you cannot get COVID from the two vaccines that are out there. They are not whole viruses. They are, the messenger RNA, an enormous step forward in immunicity for future infections.
I will just say quickly with this, I'm blessed to have a very medical family. My mom's a nurse, my mother-in-law's a nurse, sister-in-law's a nurse, and during the pandemic, both my mother and sister-in-law actually contracted COVID and spent time out with that. And when they went through and got their shots, and Jens, I'm sure yours worked even if you didn't have the side effects.
I hope so.
They both had some of the shakes, they had some of the fevers, they had some of the soreness. And I heard from one of them that after the second shake, when they were sitting there shaking a little bit, they were saying, better than COVID, better than COVID, better than COVID. So there are some side effects, but from at least personal family experience and talking to others, it's still much I than getting COVID.
Yeah.
Well, we're going to have to start to wrap this up, but let me just, before I turn it back to Andriat, ask if, I think we've covered a lot of ground in an hour. If anybody has any closing thoughts on anything we have not addressed in the course of this conversation.
I would like to just address the first question in the chat because it's about a 90-year-old neighbor who needs a vaccine pretty quickly. We're seeing a lot of this sort of folks, as I mentioned, who are falling through the cracks. They weren't part of the long-term care partnership, and it's hard for them to deal with the Hunger Games process of getting an appointment at CVS or through one of the hospitals. So I know the county is not here today, but I have spoken with the county about folks in this situation. As I mentioned, there were 17,000 folks on the list last week over 85. I know that the county health department has every intention of getting an invitation out for vaccines to anyone who is on their pre-registration list over age 75 within the next 3 weeks. So I know there was a delay in the vaccine shipment, so I don't want to swear to this, but I believe they invited everyone over age 100 this week, and they will be working their way down from that. So my hope is that your neighbor can get an appointment through one of the hospitals or one of the pharmacies before that. But as again, vaccinator of last resort, right? The county will be making sure to send invitations out to all the elderly over the next few weeks. So that is one opportunity.
All right, you might remind me of something I was going to ask you, and I know our neighborhood listserv, Wingate, has people popping up volunteering. Look, I just got an appointment for my grandmother. I'm happy to try to do it for other people who may not be either have access to the internet or be comfortable with it. Do you know of organized groups or networks where, somebody, if they do need this kind of help, could call and say, look, I'm not able to sign up online. Can you assist me?
There's a group of people. It started as teacher volunteers called Vaccine Hunters. They've been getting some press. They have a very active Facebook group. It's grown exponentially over the last week. So if you go onto Facebook and look for Maryland Vaccine Hunters. Also, I have an email e-blast, so I'll be sending out a link to them as well today. So if you can't write it down now, but if you can partner with a volunteer from Vaccine Hunters who will spend hours on hold on the phone for you, search the internet relentlessly for you. If you fall into one of these really vulnerable groups, extremely elderly, particularly elderly people of color, these volunteers are working really hard to try and help them. And as I mentioned, also the neighborhood senior villages are, again, groups of volunteers who are working so hard to help make sure our elderly are getting vaccinated.
Ariana, Yancy, Brendan, thank you very much for your time. It's been very valuable. Andre, I'll send it back to you.
Yes, thank you very much, Lou, and thank you to our panelists. I hope everyone who signed up and listened today got a lot out of it. I know I did, especially with the county attempt to resolve the equity issue along with trying to get the dosage or the vaccine out to our elderly individuals. So there's a lot of challenges involved, and I'm glad our panelists were able to add some clarity to that, and hope all of you who listened in got some good information out of that as well. And we hope that the county and the state continue to improve the process, streamline the process, and try to make it easier for not only our elderly, but all of us, and our most vulnerable as well, to get the vaccine as quickly as possible. So on that note, I'd like to thank everybody again. And my name's Andre St. Gerard. I forgot to introduce myself at the beginning. I'm the chair of committee for Montgomery. So I'd like to again thank our sponsors, some additional sponsors that I'd like to thank before we close out: Andy Stearns, Office Furniture, the Asian American Political Alliance, Corrality Capital Consulting, Cornerstone Montgomery, Erie Insurance, Etheridge, Quinn, Kemp, Rowan, and Hardinger, GCAR, Interfaith Works, Joseph W. McCartan Insurance, MCEA, UFCW Local 1994, the Montgomery County Economic Development Corporation. And those sponsors I'd like to thank. And to all of you who joined us today, please be on the lookout. Our next virtual event will be about transportation. So we hope to have a very informative session on that particular topic. So again, I thank you all for joining us. I thank our panel, and I thank Lou for moderating. And I wish you all a good day and have a good weekend. Thank you, everybody, for signing up, and have a good day.